together, putting them in their container. So it is important that you accurately count the drugs, the pills, the number, the capsules, and other dosage forms. That is, it could be intravenous, it could be, anyhow the dosage comes. You should be able to count the medications. That's one. Another thing is packaging these medications, placing medications in their appropriate containers, whether it's blister packs, whether it's bottles, whether it's vials, like I talked about, those containers that used to be closed, mostly that needs to be, that you can close bottles, vials, blister packs, and so on and so forth. It's important that you know how to package. If it's containers that needs to be closed, you know that it is closed tightly before you give to the patient. You know exactly what, if the one that needs to be sealed, medications are packaged differently. They are the ones that can be sealed, and you have to now come and pull the seal out, round it, before you can actually have access to opening the container. This is quite important. All right, so that's packaging medications. Okay, another thing we can do, or we should do, is we have preparing drugs using the aseptic technique. The aseptic technique. Now, what do we mean by the aseptic technique? Anything aseptic. You should know that it's something that talks about infection, that talks about proper way of doing things, cleanliness, avoiding contamination, infection. That is what aseptic means. That word aligns with that. So using sterile techniques when preparing medications that require a sterile environment, such as injections or intravenous solutions. Now, permit me to pause at this aseptic technique so I can explain it better than what you see there. Now, aseptic technique simply refers to practices and procedures that help you maintain a sterile environment, a clean environment, void of contamination, void of germs. Now, what is the goal? The goal is simply to keep everything clean and free from germs, to ensure that patients are safe, to ensure patient safety, especially during some procedures, like maybe in giving injections, maybe like performing surgeries or preparing sterile medications. There is no drug, no medication that easily gets contaminated and that has adverse effects on contamination as injections that are medications that are intravenous, that has got to do with the blood. If you take a tablet, it takes a couple of hours before, not hours, but it takes some minutes before it can actually digest, following all the metabolism that we talked about, movement, circulation, and all that. When you have an intravenous drug, it's in a split second, because it goes directly to the blood. It acts faster and quicker than you. That's why when you are ill, they'll tell you take injection, just take intravenous, because it helps to be fast. So anything they want the result to be spontaneous or to be fast in case of an emergency, they go for the intravenous than saying you should take tablet. There may be other forms of medications, but it will not have that same speed of efficacy as the intravenous. So while need to follow use the aseptic technique, make sure that it is free from germs, because if any slightest thing as contamination affects the injection or affects the medication, it goes straight to the blood, and there is no two ways about it. You know what people can have disastrous technique. Keeping special rooms, and not just everywhere. It's not just anywhere, any place in the pharmacy that is used for preparation of drug, or in a company. No, the places that are kept are singled out, or how do I put it? They are separate. A special place, maybe special rooms or workspaces that are specially kept for that purpose, that have filtered air, because we need filtered air to continue to maintain that to continue to maintain that hygienic situation while preparing drugs. So this is very important. Your personal hygiene too, not only about keeping a place neat, your personal hygiene, I was talking about that. Your nails, your fingers, as a pharmacist or pharmacy technician, you don't have that finger that will be from here and reach maybe Lagos or reach, you keep small, short fingers. Why? Because germs inhabit, they stay under the fingernails. That's why we talk about proper hand washing. Those that you wash your hands, your thumb, you make sure that you don't carry long nails, because there is no how you tell anybody long nails will harbor germs. Will harbor germs, even if you clean your nails every second, one minute, to still harbor germs. So it is important when we are going with this aseptic technique. Okay. So all tools, sterile equipment too, who can help us? Who wants to go to hospital? Please. Sterile equipment too. All tools and equipment must be sterilized before use. This is another important, this aseptic technique is still under everything you can do to ensure that anywhere or anyhow you contact germs is guarded against. That's the aseptic technique. So you sterilize the needles, the syringes, and the instruments that will come in contact with medications or with the patients. Very, very important. You minimize limit how much time the open containers are kept open or instruments are exposed to the air. Why? Because it reduces the chance of airborne germs contaminating them. So as much as possible, even though they need air, you keep the containers, but you have to limit the time with which those containers are kept open to avoid airborne germs contaminating them. This is very important. Proper handling too, we cannot overemphasize that. We cannot talk about that. Proper handling, how do you handle this things that you use? When you're opening a sterile package, how do you open it? The healthcare worker you must avoid touching anything that will come in contact with the sterile products. Very careful. Very, very careful. Extreme carefulness when you are using this aseptic technique, when you are preparing in preparation of drugs. And this is important. So let's move so that we don't have, but summarily, if you still don't understand, I want to break it down like I like to do. Just think of aseptic technique, since we are all women, like preparing food in the kitchen. You want to prepare food in the kitchen. Just as you wash your hands and use clean utensils to avoid food contamination, that's all the same thing. You wash your plates, wash your hands, do everything clean so that you avoid any contamination. That is the same thing. Health workers need to follow similar practices too to ensure that everything remains clean and safe while they are dealing with medications or they are performing medical procedures, because it comes with a lot of benefits. Your patients or the people that actually patronize you, seeing a neat environment, will understand that they are safe, would learn to trust you more, and a whole lot of benefits comes with it. So let's move to the next slide so that that is the aseptic technique. Then medication reconstitution too is very important. Reconstitution of medications. How do we do that? Medication reconstitution. Sometimes, and most times, we used to have some kinds of drugs that come in maybe solid form or powder. Let me say powdering. They come in powder. So you need to dilute it. You need to mix it, with a diluent. You need to mix it with either water, or you mix it with another medication that is watery, that is lighter. This is very important for us to know. So that is simply reconstitution of medication, to mix it, to change it from the original form. Why it is always done is so that maybe it will make it easier for the person that is actually swallowing it to take it in a better way. That is one of the benefits of drug reconstitution. And some of them, to ensure that it's not contaminated, it's always easier to take them in their dry form. That is what I mean by reconstitution, to take them in their dry form. Sometimes some of us that are mothers, we know that they can say, give this person drugs like this. You understand? They can say, when you go, put this particular mils of water or dilute it like this, so that the drug can, from a powdery state, can become liquid. So that is just it. If you need to reconstitute a particular medication based on the instruction of the manufacturer, maybe put water, shake it, and equally when you do it, you have to be careful so that to avoid bubbles. Sometimes when we do this, I remember when we used to be growing up, and they say the emotional stress. Imagine the stigma. Imagine everything put together that that person will go through, only to discover in the long run that it was actually a mistake, that that result was not meant for that particular person. Can you repair rather the damages that have been caused? Of course not. So it doesn't take anything to actually do the right thing. That is, I'm relating that situation here. Labeling medications, it is important that we label medications properly. And how do we do this? How do we get it done? Now, patient's name is very important. The name of the patient, the prescription number, the medication name. Remember, we talked about generic names, we talked about brand names, we talked about the strength, the concentration, or the potency of the medication. This one, the pharmacist should be able to put that together, the pharmacist. Now, the quantity, the total amount of the medication dispensed, this is important. Not only the medication for the patient taking, the medication that is left on the shelf. You should have accurate record of it. The total amount of the medication dispensed is very important for us to note. We should have a record to ensure continuity, because you will take stock. Remember, inventory. You need to know, okay, this total amount has gone out so far. This is what is left. This is the one we order. Also, too, to know the total amount that is dispensed, that you are giving to the patient at any point in time. All these are things that we really need to take into consideration. The dates that this medication is dispensed is another thing. The dates, we should not joke with the dates. We should ensure that on everything, there is the date to minimize. Oh, why is it moving? Oh, this thing should not stress. Good. This was where I was. So the dates the medication was dispensed, the use by date, which day, the date which the medication should be used. When should this medication be used that has been dispensed? When should it be used? Instructions for the patients as to when to take the medication, how much for them to take, and the precautions. Some you tell them, depends on the drugs. There are drugs that you know that naturally make people drowsy, make you dizzy. You know, so these drugs, you should be able to tell the patients, okay, don't take these drugs. In fact, drugs generally are advised that okay, it's advised that when we take these medications, that they actually know when they should take the drugs and when they should not take the drugs. This is very, very important for us to note. When should you take drugs? Don't take drugs while driving. Don't take drugs when you're on the steering. Don't take drugs when you need to do any job that will require you stressing or using your full senses. As in, what I mean by full senses, making you active in it. Don't take drugs during this time. So these are some of the things you need to tell them. Okay, the precautionary measures. Don't take it before you take this hard food. Don't take it before you do this, or take it at night when you be in a lying position. These are different things you need to, depending on the medication and what is involved. Now, the number of times the drugs can be refilled. You know, we talked about refillables. We have drugs that are refilled. You keep going to take more of the quantity, refilling. Then the name and contact information of the prescribing health provider. We talked about that already. The name of the place the prescription is actually coming from, the healthcare provider, the doctor, or the hospital, where it's coming from. You need to have your details. Pharmacy information, the name and contact information of the pharmacy. If the prescription is actually maybe coming from another pharmacy, or you need to have that name and the contact information so that the patient themselves can equally have it in case anything goes wrong. Where did you buy these drugs? Oh, I bought it from an Intam pharmacy. I bought it from Lily Pharmacy. I bought it from here. They have the name and the contact information of the pharmacy. This is very important. You know that they collaborate, they network. Even for a hospital that gives you the prescription to go and buy in another chemist, the hospital has to know where you got that drug from in case of anything. So you see, it is very important. So pharmacy technicians must ensure that their labels are accurate, they are legible. They are accurate, they are legible, bold enough for even a blind man to see. Permit me to say that too, that even a blind man can see and read. Completes the dosage and the labeling to ensure that they prevent medication errors and ensure that patients are actually safe. We have better health outcomes at the end of the day. So you see that your role is super important. Your role is very, very, very important. Okay. All right. So now, best practices for medication preparation and labeling. Best practices for medication and labeling. So this is very important. Now, use clear and simple language for patient's instruction on the label. We've talked about that. Double check, always double check. When you make a prescription, you dispense drugs or you're attending to a patient based on the prescription, always check the details, verify the medication, check the detail. When you are done, carry the medication, look at it, verify it, align it side by side so that you'll be able to actually know whether you have done the right thing as regards how the prescription is. Now, ensure that warnings and precautions are visible and emphasized when necessary. All these things are self-explanatory. You can be explained. Confirm that all packaging is secure and child resistant. Yes, that's another thing. Packaging designed to be difficult for young children to open. That's what we mean by child resistant packages or packaging. You know, there are some drugs that a child cannot at first glance just pick it and open and know. There are some drugs like that even you, the adults, it takes you a couple of time to be able to open it, you know, and access the drugs or the medication. So those are child-resistant drugs. Confirm that all packaging is secure and child-resistant where applicable. Not all drugs are child-resistant anyway. Maintain a clean and organized workspace to prevent contamination or mixing up of medications. That's to say, do not have a rowdy space. Have a space that would be able to contain with what you are actually doing. Very important. That will not have mix-up, will not make you mix up this drug to that drug. Always clear your space and make sure you have the barest minimum of containers of drugs or things within your disposal at a time. This is important. All right. Okay, this one is saying this. So another thing is dispensing, like we talked about. Medication dispensing is a critical step. We have already said that. So continuing medications, pharmacists should use different methods such as manual counting. Now, another aspect, still talking on medication dispensing. Counting of drugs, there are different methods. We have the manual counting. We have the ones you can use devices. You can use different devices to count, automated dispensing machines to ensure the correct number. Okay, now at this point, because I am talking and talking, so let me ask Madam Patience if you are there, because you know I keep using you as the reference because you are actually involved in the day-to-day carrying out of this particular thing. So can you tell us what are the things that you actually use in your facility to count medications or to count drugs? Madam Patience, are you there? Okay. Maybe it has happened again. Madam Patience. All right. I don't know if it is my network.
Can you hear me? Can you hear me?
Yes, I can hear you now. Good.
I said we have counting trays, a plastic.
Good, counting
that
tray.
we use in counting, yes. It has like two
place,
partition.
yes, that can filter, that can bring out the drugs one side.
Yes.
Hmm.
Then with the spoon,
Good,
we
good.
have plastic spoons we use, all these takeaway spoons.
Okay. Thank you
That
so
is
much.
for counting.
Okay. Thank you. So we have a lot of those devices, like we have the counting tray, like you said. I used to love to see that because there's a way they count with the spoon and they just tilt it a little and it brings out the drugs. So
Yes.
we have that. Thank you so much, Madam Patience. Then we also have machines. They are in big, large pharmacies. We also have machines that we use to actually do the counting of the drugs. They help you. It's just a machine. When you plug it, all you need is to input the number of the drugs to come out, and then it just comes out based on that number. It's just like a computer that you input something and it just comes out. So we have different things that we can use in actually counting this drugs or dispensing the drugs. So in any pharmacy that we find ourselves, we should try to align with the things that they actually have, because different places with their difference, some may not really have those very big machines. So we make do with the things that we can find. Okay, also we are looking at packaging medications. Now, medications are typically packaged in appropriate containers, like the ones that are syrup, the ones that are liquids, and even the others that are packaged. So we have different things that we use to package the bottles. We have vials, like we talked about yesterday. We have blister packs. Now, it should be easy and clear to read. If you are packaging it, it should be clear to read with the name of the medication, with the quantity labeled, and with the strength as well. So these are very important. Okay, then preparing medicines for dispensing. How do you prepare the medicine? Some of these things keep coming up. So if anything reoccurs, you understand that it is because of they are trying to place emphasis on it, and it's very important. That's why you are seeing it really reoccur. Okay, reconstitution, we already talked about that. Drug reconstitution, when you maybe require to make that drug liquid before dispensing. The drugs did not actually come in that form, but you have to make it liquid in a liquid form so that you can easily dispense it to the patient, or dispense it as gift to the patient to actually take afterwards. So pharmacy technicians must follow the manufacturer's instructions carefully to ensure proper preparation. Now, and taking two, we have the unit doses of the packaging. We have the unit doses. What's units? How are you supposed to take? We talked about units, measurements of units. Is it supposed to be 5 meals? Is it supposed to be 10 meals? Is it supposed to be two tablets? How is it supposed to be? Very important. It helps you to label them well, and you also let know the dose package. We also have, excuse me, let me drink some water now. Okay. So we also have the IV preparation. The IV preparation is for like intravenous. Remember, we talked about abbreviation. So IV is intravenous. That's what it means. I don't know, my network is disturbing. Please, are we together? Can you still hear me?
I can hear you. I can see your screen.
Thank God. It's actually giving me a little troubleshooting over here. Thank God. So we have the IV preparation for the intravenous. We already talked about preparing the intravenous drugs. Remember, we talked about aseptic technique. We talked about all those things. So while actually doing that, you should know that you follow the right techniques in preparing these medications. The intravenous ones are the most important, the ones that are easily susceptible to contamination. So as such, you have to do them under hygienic conditions and using the proper using the aseptic technique method to make it free from contamination. Then we also have expiration dates too. Very important. There are people that ordinarily, now let's move away from the pharmacy setting. You go to buy something from the supermarket. Some people don't even take note of the expiration date. That one is just a normal and on a fine day. They don't even take note of the dates. You know, whether it expires or it does not expire, their own is just to buy whatever they want to buy, and they leave without checking the date. So you should not be like that in the drug dispensing arena. You know, expiration dates is very important. We need to check. We need to know so that we can know and also know the shelf life of every drug, the shelf life. Everybody, just as we have lifespan, so drugs have their own lifespan. So it's important to check the shelf life of every drug, the expiration dates, and of course, when you are also dealing with those drugs, especially those that have big pharmacies, now, you also need to know that there is what they call first in, first out.
First out. People.
So thank you. So you know that when you are even selling the drugs, you are following them, because if you have to deal with the ones that have entered first, those are the ones you send out first, because those ones that have entered first have a shorter shelf life. They are closer to their expiration. So you have to handle those ones first before. So there is FIFO, there is first in, first out. Very, very important in this. So when you have these drugs, you should be careful. You too, you have to monitor. I've seen people that actually sell products. Let's move away from the pharmacy setting now. That actually sell products, and they don't even look at when it will expire or when it will not expire. They are not even interested to do that. They just want to keep moving, you know, and sell. They just want to sell their products without taking into consideration whether it's expired or not. Occasionally, what you should do is to look through your drugs, so that anyone that is expired, you don't by mistake. By any mistake, you don't make mistake to sell it out to anyone, because you are just killing the person hands down, and that's not why we are there. You understand? So you are very careful as to the expiration dates. That's what I'm trying to say. Anything we buy, not even only drugs, first thing, as medical practitioners that we are already, we should look out for the expiration dates, because these things really, really matter. It's important. Then recalls too. We also have what we call recalls. Medical recalls. Now, pharmacy technicians must be aware of any medication recalls. That's any drug that has been recalled. Now, what do we mean by that? What do we mean by recalls? They refer to the process of removing a drug from the market. Sometimes you get to hear, so drug, oh, it's no more in the market. It's because he did this to somebody, or he did that, or it cannot be produced. Maybe the things needed to produce it is not available again. So there are many reasons why drugs can be recalled. So if you are aware of any recall in the market, it could be due to contamination, like I said. It could be due to incorrect labeling. It could be as a result of anything, discovery of maybe adverse effects from people, feedbacks from people that were not known when that particular medication was approved. So those are the things that it will be recalled. It will be taken out of circulation, taken away, so that it doesn't harm more people, or it doesn't actually continue to do the reason why, with which maybe detrimental to people. So that is recall. And it can be, like we already talked about, it could be as a result of adverse effects or consequences. You know, there are times people actually take drugs or medications, and it has serious consequences. So it is with the medical practitioners, they go back. FDA, there's something they call FDA, and in Nigeria we have the NAFDAC and other bodies that sits together. They try to go back to the drawing board to see what are the reasons. We are getting series of complaints that this drug is doing this or doing that internationally too. So sometimes, there was a time I heard of a particular drug. I don't even need to mention it on this platform. I heard of, they say the drug is not good. It's killing people. When you press it, it's very soft. Is this, is that, is that. Because of that, even people that don't even know the exact reasons, just hearing that, it puts fear in them. They refuse to buy those drugs. So you see that anything health, people are very conscious of it. So it is important that pharmacy technicians must be aware of these medication recalls that are issued by FDA. Now, let me tell you the full meaning of FDA. FDA is a regulatory body that is in charge. It's actually in the US, sorry, that regulates. It's an agency in the United States Department of Health and Human Services that regulates all those drugs, protects public health, the safety of people, the efficacy of drugs, the security of these drugs, and medical devices, not only drugs, medical devices, equipment that are used, all these BP machines, machines for X-ray, machines for scan, different things, anything in the health sector that has got, they really move to streamline, they check and be sure that anything that is put out there for people to use is actually safe. They also look at tobacco too. Not only that, they do a whole lot of any intake that someone takes, anything that has got to do with the system that you take, be it food, be it usage, be it machines that you use on your system, that's what they actually do. So anytime it is observed that any particular drug that has been approved, that has passed through all the rigors, people are complaining about it, and this is that, and that is this, they recall such drugs immediately out of the market. So we as pharmacy technicians, as well as pharmacists, should keep ourselves abreast with these regulatory agencies and understand and get to know what is happening, update ourselves. Now, recalled medications too should be removed from inventory and returned to the manufacturer. When such things happen, what most times comes is, if they say this drug is not good or this product is not good, not only drug, is for you to gather and return to the manufacturers. That is the best way. That is the way that is approved. You return to the manufacturers if they are reachable, if they are within where you can. Wherever it is manufactured, it is advised that it should be returned there or properly disposed of. Two things, either you return it or you dispose of it properly, because if you don't do it properly, someone stumbles on it and uses it, it's coming back to you. So because we are looking at the safety of all humans, we are looking at, we are having humanity in view, so you should do whatever you need to do right to avoid issues in them. So now, patients counseling. Patients counseling is very important. It's very essential for pharmacy practice. That we cannot overemphasize that. We cannot overemphasize the need for that, for us to counsel patients. Not only drugs, medications. Some pharmacies is also part of the practice of the pharmacist. Like I told you, that some pharmacies, you go to buy drugs, maybe you are confused, especially drugs that are not prescribed. Maybe you are confused as to, oh, this is what I'm feeling, this is what I should take, like you can see on those pictures. Yes, you have opportunities whereby you speak to the pharmacist and you have counseling. The pharmacist talk to you. If the pharmacist is not there and you have the right knowledge, like you have the experience, good, you counsel, you talk to the patients about certain medications, when they should take it, why they should take it, the importance of taking it. Like me, I really needed someone at that time to really give me that counsel, to tell me, see, you don't have to be taking drugs and remaining them, because if you are taking a drug for a particular reason and you take part of the drug, it gets to the point where you start getting better, you start feeling better, and you find yourself and relax, and you are very happy. Oh, I'm well, like I used to do in those days. It's so many years ago. It's not now. So I have changed. I'm a changed person. So if you now find yourself and say, oh, I have taken these drugs, I am fine now. There's no need. They wanted me to take for 7 days. See, I can jump up. I don't have those symptoms again. I'm very well. If someone had really counseled me and really told me, you know, talked to me well and told me that the adverse effect of this thing you are doing is that if you don't complete a dose, it will come back 100-fold. That same illness, you may be feeling that you are better now, but you did not complete the medication to fight that illness in totality. You just did half. By the time you are relaxed, it will come again. And this time when it comes back, it will be serious. It will be more. Those Bible BK students, thank God, I think we are Christians here. They say that the devil goes back to bring back 7 other demons.
When they find the house garnished,
Aha,
go back.
Thank you very much. Now go back. So that is just what I'm trying to say. I'm trying to relate it there. So the A to Z of it is you have to give them counseling. You provide patients with information about their medications. Talk to them. Don't be tired. That's why a pharmacist has to be cheerful. Like I tell nurses, sometimes I get to see some pharmacists, I get to see some nurses, only their faces alone, only the faces they put up, only the kind of face and manner with which they treat you will even increase the ailment that you went there for in the first place. You are going there to seek help. But at the end of the day, you are going there with additional issue. So that is why I tell health practitioners, all of you, just be jolly good. Be jolly good fellows. Just be happy. Don't transfer aggression. Even if you didn't get feeding money, and then you are angry, you are coming to work and your husband does not give you money for feeding and all that, and you are like grumpled and sad and, you know, disgruntled, and you are coming to work, put up a smile, be happy. In fact, put all those things in your pocket and do your work. By the time you get back home, you can remove it again and wear that look. So that's just how it is, because patients need to see that reassuring look. They need to see you smile. They need to see you happy. Like this particular note, I'm trying to advise Madam Nena and Madam Patience that would have pharmacies soon, that whoever you place in your pharmacy, don't only think about you having the right knowledge. Whoever you place there should be people that would actually give you a good name. That will be people that will actually have an amiable disposition to patients. Very important. Me, I don't have a pharmacy, and I don't really think I'll have one, you know, because I already have too much of load on my head already. So that one will be additional. So, but it's just an advice, because what many people don't know is you would not be there 24/7 in your business
You are
facility.
right. You are
You will
right.
not be there. Many people that crumble businesses for others are people that will just perform one kind of character, will just exhibit. They don't have good customer service. They don't have good relationships with business, with people that come to them. What can make you excel in business is your attitude. Attitude is everything. Your disposition, the way you carry yourself. I tell people this a lot. Two people may have started running a race, but it depends on how well the other person could carry himself or herself and could move swiftly that will make the person finish up. That I tell people. It's not how
The
far, but
starting is
how
how
well.
well. Yeah.
So when you have pharmacies, one major thing is just like a hospital. You smile with patients. I don't say you should smile sheepishly, but smiling, you smile moderately, you smile, you have an amiable disposition. You have a disposition that when a person comes with so much of a burden, when a person comes with so much of illness, automatically the person seeing you alone has made that person feel half better already, even before the person is given medications. I tell people. So it is important, just like the mental health that we had. I try to tell people that so many people that have lost it are because they lack that shoulder to lean on, are because they didn't have that environment with which they could air their views and they could discuss with people that could have helped them before that particular condition degenerated to the states with which it went. Or it was. So I don't have to overflog that. So when you have people, just like you can see that those pharmacy technicians, you have people that put up a smile, that talk to you in a respectful manner, that understand that you're a human being as well as they are. These things go a long way in helping. Sometimes you walk into hospitals and you see the way nurses, some nurses, not everyone. You see the way some nurses behave. Like me, that I'm already into this health thing. Sometimes I'm a psychologist. I have a PhD in psychology. That's why I'm referred to as doctor, and other certifications too. When you walk there, you get to see some people. I study people. Immediately I see you. All I need is just to see your face, just to see you. I can tell at a glance the kind of person you are. So sometimes you enter these health facilities and you see nurses, the way they are, it just tells you that these ones are half-baked. They are half-baked. They don't have it all. They are getting some things twisted. They don't understand what they should do. So in the course of you having this pharmacies that I will eventually patronize soonest, try to have people that will be in the front desk and that will have amiable dispositions. They will talk to the customers. They will explain to them. They will let them know that they can feel their pain. They will let them know that it's not a death sentence for whatever illness that they have, and smile and talk to them. At the end of the day, you would see that those pharmacies, they can move miles. They can travel countries, cross bridges just to come and patronize you for that reason. And you wonder whether they don't have pharmacies within them. That is how it goes in business. So let's continue. Because if I'm permitted, I can talk a whole lot concerning customer service till we'll be here till 3 o'clock and I'm still talking. So providing patients with information about their medications too. We cannot overemphasize that. The dosage, how many, what they are supposed to take as regards the dosage, and then how do they administer the routes of administration. Explain to them how the drugs should be taken. I remember one time I had a particular challenge. I was always having internal heat, like sometimes as if my tummy is very hot, I'll be feeling heat. So I went to the hospital. I was actually asked to take a particular drug that I would need to insert you know. So I didn't understand really. That was, I think, my year one in the university, and I didn't understand what to do. I just collected the drug, and the pharmacy technician or the pharmacy did not even explain. They just say, okay, this is your prescription. They say you should take this, you will insert, and off I left. Off I went. The only thing that saved me was that I could read. I could read, so I could read and then meander my way. But I was not happy at the end of the day when I went back there. I told the person, you should have explained to me what to do. You just simply say you need to insert at night. And you didn't tell me, am I to insert inside my mouth? Am I to insert inside my ear? You did not even explain. So the nitty-gritty of it is we should take time to explain this to the patients. How is this drug supposed to be taken, the routes or the routes with which it should be taken, you know, and how to take it, the dosage, the frequency, every time. Another thing I want to state here is there are times we make this mistake. People make the mistake, not you, but people that actually buy drugs, they make this mistake. How I wish we could tell them, but if we have two big pharmacies coming from both of you, I think we can still spread the word. And they will just take medications. Maybe you have to take a drug twice daily, in the morning 2 times, in the afternoon 2 times, and in the evening 2 times. And for any reason, for whatever reason, you skipped afternoon dose. You were not able to take it. It's either you forgot or you didn't have the time to take it. And then you take the 2 in the morning, you skip the afternoon dose. Some people make this very serious mistake. And what is that mistake? In the evening, that they should take 2 for the evening dose. They end up taking 4. They say, okay, I did not swallow the afternoon 2 doses in the afternoon. Let me add that 2 that I did not swallow in the afternoon plus the 2 that I need to swallow this evening and take 4 of the doses. People do make that mistake, which is very, very wrong. So it is important that this is part of the things we need to sensitize, need to let people be aware of. If you miss any dose, it means that your medicine will only move. That's what do I mean by moving? It means that if you are taking 7 days, maybe taking from Monday, ending on Sunday evening, and you have missed a particular dose, it means it will not end on Sunday evening again. It means it will end on Monday morning with the same two doses and not excess. I don't know if we've had such experience, Madam Patience, because you have been in the pharmacy. So have you had situations whereby maybe customers ask you, please, I missed this dose, or I didn't take this one, what am I supposed to do, or what am I supposed to do in this case? Have you had any of such situations? Or Madam Nenna, have you had any of such scenarios that I'm talking about? Maybe you have
Yes,
drugs and you had to take drugs.
yes.
I know somebody that do that before I
Oh.
corrected her.
Enna, please, let's hear yours too. You wanted to say.
Okay. Yes, it's not far. Even me too. I used to do it. That's the truth. I used to do it, but I know it's very wrong. But most times, I think the information I have, assuming the patient forgot or something happens and didn't take the dose, you just advise that the next you should take the dose for the next one. I don't know if you
No,
get what I'm
let me
No, no.
understand. Let me
No,
understand.
I
That
mean,
is
for
that.
instance, you're supposed to
Okay.
take in the morning
Mm-hmm.
and you forgot to take it in the morning. So
Okay.
at the time, maybe you remember it, take it immediately. You understand? So
Mm-hmm.
you cannot replace the one you've missed already.
Okay. No.
That's the advice I've
It's
got.
wrong.
Okay, that's totally, absolutely wrong. Take, for instance,
Wrong.
that you have to take an antibiotics. Let's look at that. Let's just look at a drug like that. They say take 2 in the morning, 2 in the afternoon, 2 in the evening at intervals. Then you miss the afternoon one. And then in the evening, if I understood what you meant, just as I said, in the evening, you now say, oh, I miss afternoon on 2. Okay, let me add that 2 in the afternoon to the 2 in the evening, as at the time you are taking the evening dose. It is serious.
No, that's not what I said. What I'm saying is
Okay.
you're supposed to take one in the morning and one in the evening. I'm just giving instance.
Okay.
So maybe as at you're supposed to take 8 o'clock in the morning, but as at 12 or 11 or even 1, you forgot that you should have taken it in the morning. So
Okay.
that one you didn't take in that morning. As at the time you remember it, make sure you take it immediately.
Okay.
You understand? No, not
Okay.
taking double of the dose. No, no, that's not what I mean. So
Okay, I get you now. Sorry, maybe I did not understand you. Madam Patience wanted to say something to
Well,
that.
yes. It depends on the kind of drug that you
Drug,
are taking, your medication. Take,
correct.
for instance, there are some medication that you take 12 hourly.
Hourly or 8 hourly, correct.
Yes, some 8 hourly. And the one of 8 hourly is the one that is TDS, which is the TID you
Of
made
course.
mention of in the abbreviation.
Yes,
But the
yes.
issue there is, if it's drug that you are taking 12 hourly, and you are supposed, if it is 12 hourly, you are supposed to take 8 a.m., then repeat it 8 p.m.
Yeah.
But in case maybe you forgot or something happened, you were not able to eat until, or you traveled, you weren't with your drug until maybe you got to the house where the drug, you kept the drug around that kind 11 o'clock. Take, for instance, 11. Yes, you can equally take it that 11 o'clock. But when you take it at 11 o'clock, what it means is that you won't take by 8. You have to wait till 11
another,
o'clock.
correct. You count the normal hours. So I think we are still on the same page. That's very correct. You still count it and maintain the routine of the normal hours from that time.
Sorry, there is an instance, something that happened even yesterday evening.
Wow.
A lady that had malaria, and I placed her on pialazine.
Okay, all right.
Pialazine is taken thrice.
In a day, daily.
No, thrice. That thrice that's for 3 days, but 3 tablets at once. Tablets at once.
Okay.
And when you take that 3 tablets, if you take it around 2 a.m., please, the lady came in the evening. I told her, I said, okay, she took it immediately because of her situation. She took it immediately the way she was feeling. I said, okay, the next one you take it tomorrow evening.
The same
tomorrow evening, that same time, please. Tomorrow evening, she said, okay. But you won't believe it. She came back, in short, after taking it that day before yesterday evening, yesterday morning, she took it again. She wasn't herself.
You see, it has not
She wasn't herself.
not digested. Yeah.
She said she feel like as if something is in her throat, as if she want to vomit, as if, she was restless. She now ran into the restroom. Getting to the restroom, she said what she just discovered. She just vomited. She now poo immediately. Immediately as she vomited, she saw that the food she ate came out, though the drug didn't come out anyway. But he said her brother was telling her that, are you sure, sister, you are not taking this drug wrongly?
That's
so
the
just cut the long story short. I don't know how God helped her. Though she's very huge, hefty. Her weight is, I think she's weighing 100 plus.
Oh, okay.
I said, that is the only thing that helped you.
Yes, that's what helped her. That's what she has her bones, this thing, physique is able to withstand the trauma of that thing. If it's a person that, oh God, that's why we have to be very, very careful. So there's
very careful.
It's one
and
thing.
She managed herself to the pharmacy. In short, she was the one that helped me on this program. I said, oh yeah, computer student, oh yeah, fast. She now just did it for me. I said, but how did you walk? She said she have even, in short, gone to 3 places. I said, it's just your weight that carried you. If not, I said, it's not this one you're talking about. You don't have been able to get up.
That's very correct. So that's a serious issue that we need to educate. Like we are having pharmacies, we need to educate our patient. That's where patient education comes in. The more we tell, of course, we cannot tell the whole world, but if we can do, if Madam Nenna does hers in her own corner, you do yours in your corner, I do mine, and the number of people that have the right knowledge, it will go a long way in helping us to revamp the health sector. Or the health system. Gradually, we'll certainly get there because these mistakes happen. Sometimes you just hear somebody, the person just went off after taking a particular medication. Nobody really knows, but people that know will want to know to follow the nitty-gritty of it. You discover that most times they didn't adhere strictly to the dosage and to the frequency of taking a particular drug. So thank you. That's beautiful. I love those contributions. Let's move to The next one. Okay, addressing patients' questions and concerns. Good. Now, patiently listening. Patiently listening. Pharmacy, health is just interwoven. Anything health is just together. These things that are here are the things that keeps dancing around. You do certified nursing assistant is there. You do professional diploma in caregiving is there. You do anything that you've got to do with health is there. Is the same thing, interwoven. You have to listen actively, listen patiently to patients, whether you are in the hospital, a nurse, whether you are a doctor. Don't form too busy, because some of medical practitioners, they form being too busy. They don't even have the patience to even patiently hear their patients. Very, very, it's a virtue. Patience is actually a virtue, really. So I tell people that if you know you are not patient by nature, if you know you are highly temperamental, you get agitated, there are many character qualities that are required for you to actually be able to fit in the health sector. One of them, like I keep saying, is patience. And you have to be patient. You have to listen to them. Most of these people are people that have illnesses. So before somebody will come to get a medication, of course, you know there is a challenge somewhere. So don't aggravate the issue that the person is having. Listen patiently, help, talk to the person, try to see how to work on the person's psyche. What I mean by psyche is some can even come to you at a point where they have reached they are between the devil and the deep blue sea. They're in a dilemma. They don't even actually know what to do. So they just say, okay, let me get there to that pharmacy. Let me see. At least I'll be able to, to get some form of assurance, or to get something that will really assure them or make them feel, yes, it's not the end of the road, or it's all hope is not lost. So when they come, it's for you to listen to them clearly, discuss with them, make them feel happy, and just feel, at the end of the day. So it is important that we listen to their questions and we hear their responses. This is important. Now, also, educate patients on proper medication use. We can't talk about it again. We have already said that.
Okay, so how do we do it now? The payment, how do we do it?
We include the correct technique for injections, for inhalers.
Yes.
Now, these are some of the things. If there are drugs that are actually that you require inhalers.
But sister, is that 6 okay?
Madam, is it Madam Patience? Madam Patience, we are hearing your 6 okay. Maybe you pass it to us on the system so we can also have part of what you are trying to share behind there. Yes. If the 6 is not okay, you can give us more than 6. All right, because the
a call was coming in, so I dropped it and quickly pick it from the other phone. Sorry.
I know, I understand. So, educating patients on proper medication use. If it is inhaler, how to use the inhaler. Like we know that inhalers, you have to shake, and then blow, and then you have to shake an inhaler before using it. This is very important for us to take note of while we do what we are doing in our job. So if it's inhalers, tell them the proper technique, how to use it, because someone cannot just require an inhaler and you sell the inhaler, the person doesn't know how to use it, doesn't know whether when I go, I should press the up or press the down, or I should use it how many times, or I should do this when I use it. These are things that are important. So however the type of drugs, in any way it's taken, any route that is taken, please educate the patients on the proper use. Now, provide visual aids. All patients are not the same. People have challenges. So some people may have hearing impairments. They may have hearing impairments so that they cannot hear. We don't want to say deaf, rather we say hearing impairments. Very important. And then secondly, if you have such people, then what you should do is you can explain to them using signs, using visual aids. You can maybe draw. Maybe if you want to say 2, you can draw the 2, or they relate more with seeing than hearing because of the impairment that they have. So understand, use diagrams, use visual aids to help your patients understand their regimens. It may not even be someone alone that has hearing impairment. It could be someone that finds it difficult to understand what you are saying. We have different methods of learning. It's just like a teacher. We have the kinetic method of learning. We have a whole lot. We have many different methods of learning. They are the ones that are audiovisual. They learn when they have to listen or to see visuals with their eyes, before they learn. So such children, if in terms of children now, such children, you can write heaven and earth. You can do everything that you need to do in the best way you know. But the fact is, you have not just touched that particular aspect that they need most. Some parents or some teachers, anytime I have maybe parenting classes or I have to talk to teachers, I have training for teachers. I'm a person that has, I'm a woman of many parts. So I do a lot of this training. So sometimes I tell them to say, my child does not understand. My child cannot write. Up till this age, my child cannot read, and so on and so forth. These are experiences that parents do, parents, and even some that are extremely wealthy, but they don't know the right thing to do. So that's when you know that the rich also cry too, because they have everything, but the only thing they don't have is the ability to make that child to be what he or she wants. So in such situations, I do tell them that it's just because you have not been able to. It's like person having a door to open. You've not been able to have the exact key that you just put in and will open the door. Because not just any key will enter. It has to be the key that will fit perfectly into the keyhole that will open the door. So that's how it is. If you have a patient that you can speak Genesis to Revelation, the patient is just looking at you, does not understand, then you should know that there is a challenge. Now, without being told, you should have a plan B to act immediately. So maybe this person cannot understand, or you observe. You swing into action. You could use the diagram. You could use the visual aids, any way to ensure that this patient has the right information and understands the regimen, or you understand the patient's regimen. Very important. Okay, now, providing information too that is tailored to the patient's individual needs and understanding level. Again, understanding level. You cannot, someone that doesn't understand, you start using all this QHS, QID, and so on and so on and so forth with the person. No, communication is only effective when you use the language that the people involved can understand. If you are communicating with an audience and you use a language they don't understand, then it's not communication at the end of the day. If I walk into a French-speaking country and I speak English, and I move in there, I'm giving a training, I'm giving a presentation, and I use English, like when I'm actually doing speaking, effective communication trainings, I tell people, if you can speak all the English that you have, at the end of the day, you have not communicated, because the vast majority of those people are French-speaking countries, and you have to speak in French. So that is it. So when you are speaking with these patients, you have to understand. You have to do it in such a way that they understand, and you have to do it in the level with which they understand. That is why I asked how many people have the knowledge, because if I'm talking to doctors, I'm talking to pharmacists, there are terminologies that you would use, because they will flow easily. They're already pharmacists, they have attained those heights. Now, so any particular gathering that you have to address, look at it. You are called to talk about to talk in a church, you have an idea of the people, the setting, the people that you actually meet in the church. You've seen them. You can just put it on a scale immediately. You don't have to be told before time. And now, okay, if I go like this on this particular level, gear, I put it in this gear, it will be easier for them to relate. Or you go into the market and you begin to speak grammar and big terminologies with the market women. You have not achieved anything. At the end of the day, you are back to square one. So it is important, even in pharmacy practice, that we study our patients. We know they're the ones that come in, maybe they don't even understand what you are saying. It could even result in interpreting. Maybe they don't understand English. They need an interpreter to interpret for them, to tell them what you are exactly trying to say. So any method and every method that can ensure that the patient understands, go ahead and do it with the help of the pharmacy. Remember, you work directly with the pharmacist, so that at the end, we'll have these beautiful and improved patient outcomes. And you'll be glad you did, because you'll be happy at the end of the day. So these are things that are very important. Inventory too. Inventory records should be updated. Now let's see first. Maintaining accurate inventory records, inventory management as a whole. You can have this record either computerized or manually done. Very important. You can have it in any of the ways, manually or computerized. It depends on technology. Where you have a system, everything is computerized. You want to talk about Madam Nenna, you just go to your system, everything about her, the drug she has bought, the prescription, the dose, the line of, just everything is just brought out there in the system. That is why technology is beautiful. You know, it has its advantages and the disadvantages too as well. Now, also, regular records should be updated at intervals, at regular intervals. You should update your records, your inventory, so that you know when you can restock, when the pharmacist needs to restock, you know when to have everything in place. Very important. So that, like I tell people, never run out of drugs. If you are a pharmacist, never run out of drugs, because it has killed many people. And aside that, in some hospitals, you get to go. I remember one hospital I went, after visiting, after the normal process, you know, I was asked to see the doctor, and then they prescribed the drug. The doctor was there, said, okay, take it to the nurse, get to the pharmacy, you know, and all that. And I was happy doing my thing that, okay, I'll be done with it, only for me to get to the pharmacy. Where did I see drugs? Nowhere. You ask for this, oh, madam, please, you have to get it outside. This particular drug just finished. You ask for this, oh, the last one was taken by. So at the end of the day, I was like, what is this? I just got so pissed off that what are these people actually doing? Because you don't have to wait until you have the last, because you have a trend, supply chain management, people that do supply chain, you have a trend. You don't have to wait for the last thing to finish before you restock. And you should have some form of data, previous data, that you can marry and know that, oh, this particular area, this particular location my pharmacy is like they patronize more of this particular drug. And you know that each time you have, you know that those drugs, you shouldn't leave them. There are different names. We have those different kinds of drugs. You don't let it get exhausted, so that someone will not come during an emergency, and at the end of the day, the person cannot have any drug, you know, maybe urgent situation, the person doesn't have drugs. So at the end of the day, you ask yourself, or they will ask, why are you actually there, actually practicing? So these are things. This is why inventory management is very important. Checking stock, making sure that you don't run out of medications. That's another important thing. You know, bringing prescription and you giving drugs, you have to have those medications available. Regular updates. Per levels. What do we mean by per levels? I need to explain that a little. Now, per levels are simply the minimum amount of a medication or product that you should have on hand. A minimum amount. So you should tell yourself, I should have, you know, a per level. That's when once my paracetamol gets to so packets, you should not reduce more than this number of packets. I must ensure that I get it filled. Now, that is the per level. So you should have that per level, that amount of a medication or a product that should be on hand in order to meet expected demand. Maybe when you have the expected demand based on data, based on statistics. Now, it is very important because it helps you ensure that pharmacies can provide necessary medications to patients without delay, without, oh, it's not here, come back tomorrow. Okay, go to the other pharmacy. No. All those ones. So that is why it is very, very important for us to get it right. So per levels help you to maintain that optimal inventory level, ensuring that you have enough stock to meet patient needs while also avoiding overstocking and waste. You know, when you overstock, the next thing is result. The next result will be waste. That's why you have to have a sound knowledge of supply chain management, of how to handle supply chain in that particular business, so that you know when to stock drugs, you know when not to overstock the drugs. These things are very important. Okay, so the per level too is based on certain factors. How quickly a medication is dispensed or used. Like I said, Over time, maybe if you are in a swampy area, you have your pharmacy in a swampy area where we have lots of mosquitoes, we have all those trends. That's what supply chain teaches you. So you should, without being told, you should know that when it is the rainy seasons where we have water and where we have water accumulating in the gutters, maybe around the environment, bringing out mosquitoes and all those things, that we have a high reoccurrence of people having malaria, and when you keep you are expected to stock your pharmacy to have malaria drugs, because you know that there will be a form of increase in people that will need to get these malaria drugs. So if you have that statistics, then you don't need a prophet to tell you that when it's that time, close to that time, this is the particular number you should have to ensure you don't overstock, and also to ensure that there is no shortage. It means you're working with members of your team. You can't just achieve all these things. You can't just know all these things, because it's not rock solid science. It's not cast on concrete. It keeps fluctuating, but you need to have accurate data to be able to monitor your stock levels. Now, we also have the periodic checks. Conduct periodic checks to verify inventory accuracy. That's also important. Keep checking. This is what is remaining. Carry out checks to ensure that it is the actual wow, our time, but we have to finish. We have to
Yes,
finish.
sir.
We have to finish that slide that this module. Okay.
Yes, sir.
Thank you for that encouragement. At least the encouragement has made me not to be tired. Thank you. So we are restocking medications too, maintaining stock levels. We've talked about that regularly to ensure that medications are not running low. Important. Ordering medications too. Place orders for medications as soon as it is needed, considering factors such as the lead times and expiration dates. Okay, now there are some drugs that maybe due to one reason or the other, you cannot keep them. They cannot be kept for too long due to different reasons that we already know. Okay, now, ordering medications, it's important that you place orders for medications as needed, some of these kinds of medications, considering the lead time and the expiration date. That is to say that you have to consider the lead time. What's the lead time? The time with which you can actually place the order, between the time you place the order and the time the medication actually gets to you. That's the lead time. So the lead time, you calculate. If it's a drug that I need to get it maybe after 1 month, then you should know when you should place the order, gauging it to know that, oh, as at so time, I should have this drug. And if it gets to me by this time, from statistics, I know that more demand comes at this time, and I know that it may likely expire at this time. So you do your calculation. You see, it's filled with calculations and filled with a whole lot of work. You have to be on top of your game to be able to really analyze these things. Now, receiving and verifying orders. When you order for drugs, and you eventually get these drugs as pharmacists to be and as pharmacy technicians, you must ensure that you verify, you count, you ensure that the correct quantity is given to you, that the correct products are received, that come well, that don't come with that are not already expired before you actually receive them, and that the drugs are in good condition. These are things that you need to check. Carefulness is required because it's human life we are dealing with. So you check the efficacy of the drug, not efficacy per se, but you check the expiration dates of the drugs. You check if the quantity that it aligns with what you actually ordered for. This is important. Storing medications in a secure and organized manner, following proper storage guidelines. Storing drugs. You don't just store drugs anyhow. You don't just store drugs anyhow. Just as you arrange your supermarkets, beverages one side, this one this side. You don't just store drugs anyhow. Cough syrups should be in one place.
Anti-malaria.
Anti-malaria, thank you, should be anti-malaria to an antibiotics. Thank you. So all this, you should keep them separately to ensure that there's no mix-up, so that if someone says, I need anti-malaria drugs, you know exactly where to go. As a pharmacy technician, you know you don't have to, I've gone to one chemist before. You know me, I have seen a lot. I've seen the good, the bad, the ugly. I've seen most of this. So I have a lot to talk about whenever I have trainings. I really talk about life experiences. So you see that there's one very big pharmacy that's very close to where I live. If I want to get drugs or medications, I go there. There's one particular lady, out of there about 7 of them that work there. It's a big pharmacy. Now, there is one particular one that I have observed, because I have this knowledge. So, you know, it's easy for me to spot things that ordinarily others cannot spot. So I went there to get that. I wanted, okay, yeah, that was when we had this grape water. We used to give children, for stomach pain, grape water. That time, it's not now. I learned that particular drug is not very handy again now. But that's, we used to give grape water. If a baby complains of stomach pain, we'll give that grape water. So I went to buy that. Do you know that this lady, I even mentioned the name and she was still looking at me. That was some years ago, I think 2 or 3 years ago. Now the lady was still looking at me. I said again, that I need to get grape water. Do you know she went from left to right to center to back? She didn't know exactly where the drug was until the other pharmacy technician, or is it the clerk or so, now said, she says that she wants a grape water. Okay, 2 things. I wanted grape water and a teething powder. I wanted those 2 things. It was for a baby that just started to. So I wanted teething powder and I wanted the grape water. So the lady was as confused as anything. And that's a red flag. What do I mean? A red flag in the sense that it shows that you don't even know what you are doing. If you are working in a pharmacy, I know you shouldn't 100%. No, nobody would 100% know all the drugs if you're a pharmacy technician, which is possible to know if you have the right knowledge. But at least to a large extent, 99% or 90%, you should be able to know. But you see, another person came that wanted one drug. She was still looking very, very funny. She didn't understand, as if the people were not speaking English or speaking the right language or calling the right name, perhaps, So some of these things are very, very important. So when you store drugs, store in a way that you'll be able to know where to find them. Just like in a library where you arrange books, you arrange the English ones separate. In a school library, maybe the chemistry ones, so that if someone is looking for chemistry textbook, you don't move around 360 degrees and turn around the whole library looking for chemistry book. No, it shows that you are unprofessional. It shows that you don't know your onions. You don't have the right knowledge of what you are supposed to do. But if a person that knows what he or she is doing is just, chemistry, okay, straight, you move to the location where we have the chemistry textbooks. That's where you now have to look for the specific one that the person actually wants. That is how it is in storing of medications. That is very important. Managing expired medications. What do you do? Remove them from the shelf, from inventory, and dispose of them according to proper procedures. Every facility has the proper procedures of how to keep their drugs that are expired, what to do with them. So don't do your own in isolation. Handle them. Expired drugs, keep them away. Don't say, okay, let it be in this side. After I will go and, no, not all, because someone else can make a mistake of selling it. So expired drugs should not even be found on your shelf. You should dispose of them following the normal proper procedures. Also, medication errors. Implement procedures to prevent medication errors. We've already talked about that. Tracking disposals. 2, maintain records of expired medications that are disposed of. Everything you do, record. As a pharmacy technician, record. Okay, I had to discard. Yes, please.
Hello, ma'am. Sorry.
Yes, please.
Sorry
Yes, please.
to come in here.
Please do.
There's
Please do.
a place I worked before. There's a place I worked before. So I got to know that all these antibiotics and drugs for babies,
yeah,
they are syrup. Then maybe it remains 1 month to expire, or it is up to 1 year expired. And normally they said drugs that when they expire, at least you still have the grace of 1 month.
Of
so
course.
within that expiring month, the drug is still there. So what they do is they will just remove the label of the drug of the syrup. They will remove the label, or sometimes use viral. People will not complain. So I want to.
Hey, Madam Patience, I've lost you. I cannot hear you.
No.
Hello?
Yes, go ahead.
Martha that is speaking.
Okay,
So I
it's still
said,
Patience. Martha. Okay, Martha.
in the hospital where I worked before, there's a hospital I worked before. I came to know that there's all these syrup drugs for babies, then for children. So,
Yeah.
and because what I heard is that if a drug expired, at least it has a date of 1 month. I don't know. That is what we're told. Then,
Yeah.
if that drug, that's the last month, maybe it remains 1 month to expire or is within that month of expiring. So what they used to do in that hospital is that they will remove the label of the drug. I
Okay.
don't know if you
Yes,
understand.
I do.
Or they use viral, or they use viral to just run that expiring stuff date. They will just use
Ah,
viral to
Right.
cross it like that so that they won't be able to see it. Maybe so that for them not to be complaining or something. So I want to ask, is it right?
Very,
It's
very
wrong.
wrong.
Very,
100%
very wrong.
100% wrong.
Okay.
Very wrong.
God,
You see,
God forbid.
already as they are doing that, them even erasing it or covering the expiration date sends a signal that that there's something they are trying to hide. I don't know. You know, they say a clear conscience fears no accusation. So in this case, their conscience is not clear for them doing that thing. They already know that people will complain, and it is wrong, ethically wrong, and medically wrong, any angle you look at it, for them to do that particular thing that they are doing. But you know, that's why I keep saying this. Thank you for that beautiful
Hospital for that matter.
Yes, that's why I keep saying this, that a lot of
Mm.
anomalies happen in the health sector, in the health system. It happens because you see, just that singular act can, God forbid, bring up further complications in a person's health. And the parents, like we talk about children, and the parents will be like, oh, what happened to my child? Oh, my child has taken this drug. Oh, this is, they won't even understand. It is very wrong for them to do that. Very, very. Thank God we are not working there again, because if you were working there, I would have said that, well, you kneel down and pray for 1 week. When you pray for that 1 week, the next week you will go and confront them and tell them that it is wrong. And the reason I say you should pray is that all eyes may be, you know, this is Nigeria, this is our dear country. So if you want to come and do as if you know more than the people that know, it's a problem. They may say, okay, go home and rest since you
Yes,
don't
it's a
work.
problem. They
Yes,
must have
you pray for 1
yeah.
week. And when you finish praying, you carry yourself and go and tell them that it is wrong if you were still working there. But since you are not working there, well, in a way, your hands are tied. That's just what I have to say. But it is very, very, very wrong to do that. Very wrong. And it's just like some supermarkets too. They do that. It's not even only, they can just try to see how to erode the expiration date. If it is on a label, they'll remove it so that that thing will be, and then they'll tell you, oh, that's how it came. Oh, this, of course, they will just say that. All these are, that's why we said a pharmacist or a pharmacy technician. Remember, we talked about integrity. We talked about honesty and integrity yesterday, that it is important that you keep your integrity. Do not, because it's human life, a banker can gamble with money, with cash. You can maybe keep money and then the banker carries the money. Your bank officer decides to make do with the money to go and do anything. That one is money. It's a different thing. People that are in different professions can do, but when it comes to health, no, you cannot gamble. You can just kill somebody. So if you gamble, then why are you actually there in the process of saving life? It's futile. So thank you, Martha, for that beautiful. Yes.
Excuse me.
Yes, ma'am.
Like we said that
Thank you.
is wrong, very wrong. Why I said very wrong is because the way they went about it. I'm talking now, I like using myself as a case study.
Okay.
Where I work, we have general hospital in that place.
Okay.
But I discovered that we have had more than 1, 2, 3 of this kind of case. Very wrong in the fact that they didn't do it well.
The proper way, yeah.
Because they have sent a wrong signal. I think to Nena, was it Nena or Martha that asked that question?
It's Martha that talked
They
about
have sent a wrong signal to her. Because the place where I'm working, one day, they just came for aminophenil injection.
Okay.
It's for asthmatic patients.
All right, yeah.
Yes, for some of them, they may even use the inhaler, depending on the situation.
And how serious it is, yeah.
Yes, that you will now need to just give the injection fast. So they sent for the injection from the general hospital. And the one that we have left is going that month. That's, take for instance, as you are in October now.
It's expiring in November.
Hello?
Yes, I'm trying.
Hello?
Yes, I can
Hello.
hear you. I can hear you
Oh,
now. I can hear you now.
sorry. Okay, sorry. So, do you know what I
The network is troubleshooting. It keeps
I
breaking.
called the doctor? Can you
Okay.
hear me?
Yes,
I
you
called the
called the
doctor
Mhm.
that, okay, the aminophylline that we have now, the one left this month now, that thing happened, I think, last month.
Okay.
Though it can still be used. Are you with me, ma? But
I'm with.
I didn't just give it out. I just called. The doctor said, give it, madam. You understand? Now you're a pharmacy, you understand. Give it out. Let them bring it fast.
My
Oh,
God.
oh
And
God.
immediately I gave it out. Even as I gave it out, are you with me, ma?
I am
I
with
didn't
you.
even talk about the price. I think, was it 500 naira per ampoule of that injection? But I just gave it to them. I said, Joya, just go. Bring whether 200 or 3. I can't even remember again. Even though it can still be used. Are you there?
I'm with you.
It
Yes.
can still be used, but you shouldn't do it the wrong way.
Wrong way. That is it. That is
Changing that
correct.
date or removing is wrong.
It's wrong. It can still be used because it has not
Yes,
expired. It has not
yes,
expired. It has like a month to expiration. So why
yes.
I mean,
Do you
it's
understand? And immediately they use it. I think there was a case again of adrenaline. Sorry, all this one I'm mentioning, but I know you will understand it, what
go
I'm
ahead.
talking
Go
about.
ahead. I know
At the end
adrenaline.
of the day, we still give it out. But we have already removed
Funny
it from the
enough, I
shelf.
know those drugs, so I know this adrenaline and aminophylline because
Okay.
I still use them, yeah.
Okay, we
Okay.
have already removed it from the shelf. It's already inside the office, our injection office, the pharmacist office, where we have our poison cupboard. That is the control drugs, where we
Yeah.
store it. We call it poison cupboard.
It's okay.
I brought it out from there. I gave it to them. So sometimes, depending on the case that you have and the urgency of that
Of the need of that
drug or the
medication.
injection at that point in time, you can still make use of it, but not going the wrong way.
Very bad to go the wrong way. Very,
Yes, very, very bad for that hospital. In short, that hospital need to be closed down, safe.
In fact,
Sincerely.
sad. It's very sad to
enjoy
hear.
doing it. They are happy doing it. As
It's
in,
hard.
when
It's
it was in,
heartless.
I was like, why are they doing it? They said, oh, you must do it, you must do it. There's even one I did. I didn't wrong. They said, why would they have to call the patient back? I said, sorry, let us check. Maybe we did a mistake. So for me to find out
Hi.
that they are trying to run our date of a thing. Like
This
that.
one made me be afraid of hospitals now because you don't even know what they're injecting you.
Yeah,
That is, see, the truth is that we need a total revamping of the health system. I don't
that
know.
is
It's
it.
only
Correct.
God that can do that. It's not only pharmacies, not even all these things. Every from doctors to nurses to pharmacists to everybody,
Yes.
the whole place is polluted with all these anomalies.
Polluted.
So it's always sad whenever I have to be hearing these things and I get to experience them. Sometimes when I move round, I get to see all these things. Since I already have the knowledge, I've taken a lot of certifications and I'm into the health system. Sometimes I weep for people. I weep for people when the right things are not done because you yourself may not even know what is happening. You will not. That's why many people don't even know what actually kills them at the end of the day. Not when we
Yeah.
hear that people, you will not know. They'll just say, slept and didn't wake up, went out and didn't come back, fell down, and all these things. You can't even explain how the things come about because of little things that should be done correctly. So whenever we have health lessons, any health related course like this that I have to anchor, I am always very sometimes passionate when I get to hear these things because I've had experiences of people doing things in the way that is not proper in the hospital. That is the worst in some hospitals, especially government hospitals. I don't even understand. You go there,
My
you see
own
so many
sister
things.
died in UBTH,
Uh-huh.
University of Benin Teaching
my.
Hospital. She
You
just
see?
slept. She didn't wake up. Do you know what happened? If not because of a friend of mine, that the brother's wife is the chief laboratory person in
Okay.
UBTH. So
Okay.
since, and normally when you have a patient there, they won't allow you to stay with the patients.
Yes,
But
yes.
because she's working there, she was not the
That
one
the
going
privilege.
in.
Yeah.
You understand? Do you know that they just called a friend of mine, a doctor, gynecologist, just called that woman to let her know that my sister passed on. What happened? Nobody knows what happened to her. But do you know when she went in, she discovered that the drug, because she bought her drugs, the drug that they were supposed to give her in the night was still there, meaning that they gave her wrong drug. They gave her another patient's drug.
Oh my God,
She
patient.
just left. My sister, that was just how she died. And
Don't
left
say
the
it
baby.
again.
Oh,
She
so
delivered that
sorry.
child, died 10 days after her delivery.
Mm,
And
Ah.
it was through CS. I'm not supposed to be saying this. So these are the things that make
so
me
sorry, my dear.
in
So
shock.
sorry.
Sorry,
A
so
lot
sorry
of
about
things
that.
are really going wrong. I pray, as we're just saying all these things, we're just saying, I said, yes, that is negligent. We have to check things well, make sure we give the right drug. As we're just saying all this, I was just saying this was exactly the mistake
That was
they
made.
made
You see,
that
and
killed
very,
my
very
beloved sister.
careless, very careless, very, very careless. I don't even understand. Carelessness can just kill people. Let me just, I know we need to close, but there is even something, as you've said, that I have just remembered when I was a baby, my mother always says that till my age that I am now, I can imagine how many years from when I was a baby till today, my mother still says that. She still tells me that incident of how she took me to the hospital. I was purging and vomiting when I was very small, and then took me to the hospital. Then they had auxiliary nurses, just young nurses that just came, that were not trained. So my father and my mother took me there. The first person that entered, the second mother, it was a pediatrician actually attended to us, and we're in the ward, and they just brought me. Only for them to hear the nurse right before my parents. My mother still tells me that even till today. When she looks at me, she'll say that you actually came to live. If not so.
Oh.
She told me that that the nurse, the auxiliary nurse, a very young girl, according to her, just without their white clothes, very well dressed, just came around to give injection, moving around to give injection, went to the first child with the mother, gave the child injection. Before as soon as she gave the child the injection, it didn't take 2 seconds. The child now started to twitch. That's to to twitch. Before the mother was like crying. What happened? Yoruba, how they can be very dramatic. The mother lose the wrapper on from her waist. The second wrapper she tied. The mother was, oh God. If you see, the mother shouted, help the nurse, did drama for where the child has gone. Before they could say Jack, they could say Robinson, the child has gone. This is real, as in real life story. My mother always says it. After many years, 40 years counting, my mother still says it till this minute, about what actually happened. So another one was another person so my mother said that she saw it with her 2 eyes. And so when she finished, as if somebody did not even die, after the woman cried and everything, she proceeded. The others came and said, oh, madam, this, in a general hospital, they did not even care. They moved to me. And thank God my father was there. If it's my mother, maybe they would have been able to talk to her. But my father, being a military personnel, he was outside when this happened. My mother was the only one carrying me. So when my father heard and came in, saw her come, my father asked her, which child are you coming to give injection? Which child? That my father in the military, just to talk to her and look at her once. Told her, no. Oh, yeah. Told my mother, carry the baby and let's get out of here. And that was how they took me out of here instantly. They were saying, Oga, like they used to say, you are taking your child out, you are flaunting a medical advice. My father did not even listen. See him, they already go entering his car, take me away because of this thing. So you will ask yourself, only for them to discover that lady did not actually administer the normal dose for a child. She gave excess of she pumped the injection into the injection case that was beyond the quantity she was supposed to give to that child. So she just did it. A very young lady. I don't think that lady from my mother's description, I don't think she should be more than maybe 22 or 25. These new young nurses, immediately that's how the child, I think the mother has lost the baby because of what? Negligence and carelessness. And I don't even know. Carelessness is even an understatement. I don't know which word to actually use for that. So please, thank God that by the grace of God, we are medical practitioners and we would have pharmacists and we will keep moving further. So please, in your own little way, in the way you can, you may never know the life that you may be saving if you do that, create that awareness. You may never know somebody that would have gone to the other side of the world that you would help to elongate the person's life by making the person aware of some of these things. So in your own way, just do the little you can, because it's actually a polluted situation that we just need God and the little we can do in our own different corners to actually achieve what we want. So it's fine. God would help us. So let's look at pharmaceutical compounding. This is just 5 slides and we are done. Practically talking about how to make drugs, how to prepare drugs. Compounding, how to mix drugs and actually get the drugs prepared is what we are looking at. So, introduction to compounding. Let me take this. The preparation of mixing drugs by mixing ingredients. You mix different ingredients to actually ensure that the drug is properly prepared or meets expectation. That is the last model. So how do we prepare these drugs? Like I said, as pharmacy technicians, we are not actively involved in the, what I mean by actively, we are not really the ones doing them, except you have the knowledge. This is the pharmacist, but you are there live and direct, and you would put your hands on it. It's like someone that is learning maybe how to make hair. You would be there, even if you see how your madam is doing it. Another day, your madam can say, okay, you come, this person that has just come, you are going to make the person's hair. Part so that it will build your confidence. So in as much as you are not the main person doing it, but it is important that you know, because with experience, you will have to be practicing hands-on. You have to do these things that the pharmacy actually does. Now, it is simply you mixing and combining ingredients to create a unique formulation, mixing things together to form drugs. Pharmacists do that. And you, by virtue of the fact that you are a pharmacy technician, you will be involved in doing that as well. Okay, then we have types of compounding. We have different types of compounding. What are the different types of compounding? We have the extemporaneous compounding. That's the first, the preparation of medications in small quantities. Sometimes you can have people that you can need, or the need may arise that you have to be preparing drugs in small quantities. You know, maybe at a point, maybe in that particular instance, they need that drug. You just need to put it together and get the drug prepared for that particular patient, tailored to meet the patient's needs with the ingredients that are necessary to help the efficacy of the drug when the patient actually takes the drug. So it is customized. So that is the extemporaneous compounding, where you do that, when you just have to mix drugs in small quantities to meet the needs of a particular patient, or based on, or you customize it just as you customize something, you have it as your own. That is the same thing. Then we have the sterile compounding too. We have the sterile compounding. Sterile, anytime we hear sterile, you know what that means. Like we've talked about the aseptic techniques, we've talked about sterile, anything, processes that you make something free from contamination. That's just the A to Z. So sterile compounding, the preparation of sterile medications, such as maybe injections, like we talked about, intravenous solutions. How do you prepare them? You prepare them in a space that is void of a special space that is void of contamination, a clean, controlled environment to prevent contamination. That is the sterile compounding. Okay, this thing is just taking me. I hope it doesn't. We'll soon be done. We just have a few minutes to go. Thank you for your patience. So, role of pharmacy technicians. What is the role? You play a vital role in compounding, in assisting pharmacists in the preparation of medications, not the aides. Yesterday we talked about pharmacy aides, talked about pharmacy clerks, not those ones. You are a pharmacy technician. Next to the pharmacist is you. So sometimes you may need to fit into place to act on behalf of the pharmacist based on your knowledge, based on your experience, but you cannot work alone. You only do that if the pharmacist gives you the go-ahead to do that. And the pharmacist cannot just give you the go-ahead to do that, except he or she is monitoring you, or he or she can attest to the fact that you have the right certifications or you have the right knowledge to actually carry that out. Nobody wants to get into trouble. So that is just it. So you are responsible to help. You can prepare the ingredients. It's like a mother is preparing soup. You want to prepare soup. Now you prepare soup, you mix the soup together. I mean, you want to prepare maybe egusi soup. You have to get the ingredients. You can tell your daughter, oh, Glory, get me the pepper, get me the this, come and okay, pound the pepper for me while I do this, still under your supervision. So that is how it is, a pharmacy technician and a pharmacist. You measure and weigh ingredients for compounding. You can measure those ingredients, you can weigh them, you can do some jobs, things around that. You also help to mix the ingredients. according to the prescribed formula with the assistance of the pharmacist. Take note of that. Nothing you can do on your own. No unilateral decision on your own. You work with the pharmacist, because the pharmacist would be held responsible for any anomalies. And aside that, the pharmacy has a broader knowledge of what is actually expected. Now, packaging medications, labeling and packaging, compounding medications, you are also expected to do that. Ensure that these medications meet quality standards. You check and balance, you check and balance, you check and balance. Sometimes these pharmacists we are hearing, at the end of the day, you find out that it is even you that is doing more of the work. You and I know what we are saying, because some of them can just, especially when they know that you are well-grounded in what you do, you have the knowledge, everything, they just sit there and play the role of the in charge, and then you do most of the work. That's what happens. So it's important that you learn these things. You maintain records of compounding activities. Now, while pharmacy technicians perform many compounding tasks, they must work under the supervision of a pharmacist that I've already talked about. Pharmacists are responsible for ensuring the accuracy and the safety of compounded medications. Aseptic techniques, we have talked about that already. It's just repeating, because we are talking about compounding drugs. That's why it's here again in this slide. So it's just the procedures like we talked about on how you can get these things done. You can make these very sterile products free from contamination, a special room or a special space that is specially kept to compound those drugs, to prepare those sterile products that will be used, where you cannot even get any contamination at all. Because in this type of products, even the minutest or minor contaminations can really escalate the situation and create serious infections and high risk for the patient. So this is very, very important for us to note. Now, minimizing, what do they do? This aseptic technique, it minimizes contamination. I've already talked about that. It helps to drive away the microorganisms. You understand? Make the environment sterile, make the environment free from infection. Then maintaining a sterile field too is an area. A sterile field is an area that is designated to do those things. It's like maybe you have a place in your house where you chop meat. Maybe you have to cut meat that you just bought, and then you want to keep it on that surface and you cut it. It's advisable that the surface you use for cutting meat should not be the surface you use for cutting fruits.
Okay.
Cutting fruits, because there's what we call cross-contamination. So you have to be conscious of what you do, of the area. So that is how it is. So a sterile field is a place that is set aside to compound drugs. Why is it set aside? Because access is restricted to that place. One, there are things that will be kept in place to ensure that everything is kept well, to ensure that there's no influx of germs or things that will contaminate the environment. Preventing touch contamination. Avoid touching sterile objects with your hands. Objects that have already been sterilized, are already free from, avoid touching them with your bare hands. We have the gloves, we have things that we wash against. And again, hand washing cannot be overemphasized too in this. Any health field or any health course, we cannot overemphasize or talk too much about hand washing. It is important. Even in your house, it is important. Up until we had that COVID, people did not really understand that it's important to wash hands. I remember even when that COVID-19, when you tell some people, they'll say, all this hand washing, is somebody not tired? Can we actually do it every time? Wash your hand. You want to do this, wash your hand. You want to do that, wash your hands, please. And I'll just laugh that you washing your hand can be a very simple thing for you to do, to guard against any infection or anything, you know. So it's better. They say prevention is better than cure. Prevention is less expensive than curing. So we need to do the right things. Then work in a clean environment, a clean and organized work area to reduce the risk of contamination. Cleaning and disinfecting work surfaces. Work surfaces should be clean, should be disinfected occasionally. Clean, disinfect, clean, keep clean. apply a disinfectant solution to work surfaces and allow it to dry completely before you start compounding. So that's to say that you disinfect the environment, the surfaces, and allow it to dry, not that you just clean it and then start working. That's the mistake some people do. Maybe you use what do we call this thing? Maybe spirit, or you use disinfectants and then you don't allow it to dry. You just go ahead to do only what you are expected to do. And then you don't even care whether it has dried or not. So it's very important you clean surfaces, even in your homes where you need to clean the top of your maybe your chopping box or your shank or your sink or anything. Always allow it to dry before you actually proceed to chop whatever you want to chop or to do anything that you want to do. Clean and disinfect surfaces, very important. Hand hygiene, wow. Hand hygiene, very important. Clean your hands, wash your hands. Wash your hands is very important. As a healthcare facility, occasionally keep your hands washed. Use alcohol-based sanitizers to clean on your hands, because of course you cannot be washing your hands second, every second you pick this, you wash your hands, you do this. No. So intermittently, from time to time, you can interchange with the hand sanitizers. But the best way of preventing infection is to wash your hands. That one has been proven. It is the best way. Keep your hands clean to avoid spread of germs. Even though you use sanitizers, which is also good, but only use sanitizers intermittently. Hand washing is the most effective means of killing germs, of avoiding the spread of infection or contamination, is to wash your hands. Keep your nails short and prevent the accumulation of microorganisms. 2, fingers short, nails short. Don't carry the hair that is so long that as you bend down, it follows you. It enters the patient's mouth, or you are mixing cough medicine. The hair you are bending down, the bone straight is entering the cough medicine, and so on and so forth. So it's important that we keep our hair short. Sterile gowning and gloving. How do you wear your gloves? We talked about that. Those that did CNA, I think like Madam Nenna that actually did the other courses with us. We talked about that. How do you wear gloves? You wear gloves in a way that it does not spread infection. You don't touch it, because the outward surface, you are touching it. So when you wear proper donning, proper doffing, we call it donning and doffing. How do you don the gloves? How do you doff it? In a way, in a very careful way, as not to allow the infection to spread. The side that is already soiled to come in contact. Very important. Follow the correct technique of gowning and gloving, or donning and doffing, to avoid contamination, especially when you are dealing with compounding of medications or compounding of drugs. Very important. And not only gloves too, what you wear on your body too, our PPE, personal protective equipment that you wear on your body, on your head. You can see like that gentleman, from head to toe, he's covered. And even when he'll be removing these things, he'll remove it in such a way that it doesn't come in contact with the outward surface of the outward part of these particular PPEs, to avoid it's a machine. It's in big pharmacies, in hospitals, they have it. It provides a sterile work environment. It helps to filter the air, like you can see, filter the air, removing anything that could create maybe any unwanted air, unwanted thing that could hamper the compounding process. Very important. And they have their manufacturer's instruction for the proper use. When you get these laminar flow hoods, it comes with instructions. It comes with manuals of how you can use it, and use it effectively. Regularly clean and maintain these laminar flow hoods. You can see the examples there. I had to put the picture so that we can all see them. It's not all facilities that have this anyway, but some have it when they get to that place where that special place kept for compounding of drugs for that purpose. So that having said, this is the last slide for today. So far, so good. We have been able to talk about, been able to take 5 modules. We've looked at introduction to pharmacy practice. We've looked at pharmacology. We've looked at pharmaceutical calculations. We've looked at pharmacy dispensing practices. And the last but not the least, we've looked at pharmaceutical compounding. So God willing, next week we are going to have pharmacy and management and operations. Pharmacy, how to manage the pharmacy and to go about with the operations. Very important for us. We are also going to look at clinical pharmacy and therapeutics. We are going to have that too. We are going to have pharmaceutical technology too. We are going to have professional development and continuing education, and then work-based learning and practical experiences. We are going to have those aspects of it, God willing, by next week. So on this note, I want to say a big thank you. I don't know if we have any contribution, we have anything to say. I just swung into another mode when I heard Madam Patience talk about what I heard. You know, it's quite sad. It just made me feel, I don't know. I'm really sorry about that once again. Sorry to remind you of that, Madam Patience.
Thank you.
So if we don't have any contribution or we don't have any question, I want to thank Madam Nena. I want to thank Madam Patience as well as Madam Martha. I want to thank you very much. And I want to assure you that others that did not hop into this training, they have lost a lot. They have really, really lost a lot, because what I can assure you is that from next year, like I tell people, we have a couple of trainings on ground now, other health trainings. I tell people that strike while the iron is hot. Next year, by the time the people that wanted to hop into this training will eventually have the time to do it, of course, they will not end up paying this amount that you have paid. Thank God it is a group. By that time, you will also remind me. So thank you for taking a wise decision, and thank you for working together to ensure that we revamp the health sector. Thank you so very much, and do have a very beautiful weekend till next week.
Thank you, Dr. Dorothy.
Thank you, ma'am. Thank you so much. We appreciate it.
Over to you. Thank you.
Please, ma'am.
Yes, please.